Hello everyone, we are Team 5, Kippeum Park and Jeong. Our presentation is titled A Breakthrough in Abdominal Pain Diagnosis and AI-Based Pain Mapping Analysis, the Pain Origin Interference System. First, we'd like to talk about the background. Many of you here have probably experienced abdominal pain without knowing the exact cause at some point in your lives. Abdominal pain is one of the most common yet difficult symptoms to diagnose. This is because it often presents as vague and widespread discomfort. Such ambiguity is due to the lower density of nerve endings in visceral organs compared to somatic tissues, and the convergence and divergence of sensory signals in both the peripheral and central nerve systems. As a result, patients often struggle to describe the precise location or nature of their pain, which leads to delayed or inaccurate diagnosis. Current diagnostic methods still rely heavily on subjective patient descriptions and generalized physical examinations, which are not sufficient to distinguish between different visceral conditions. To make matters worse, complex interactions between neural, inflammatory, and physiological factors make clinical interpretation even more challenging. Therefore, there is an urgent need for an objective, data-driven system that can help clinicians identify not only the location of pain, but also its underlying cause. Abdominal pain accounts for about 7 to 10% of emergency room visits worldwide. Due to its non-specific and variable presentation, diagnosis is often delayed, and in many cases, patients undergo unnecessary testing. In fact, some studies have shown that up to 30% of abdominal pain cases remain undiagnosed even after initial evaluation, increasing both patient risk and the burden on healthcare systems. Meanwhile, emergency and outpatient clinics are under pressure from high patient loads and limited time for diagnosis. This creates a growing demand for tools that can support healthcare professionals in making faster and more accurate decisions. To address these problems, we designed a system with the following capabilities. We named this system POISE, which stands for Pain Origin Interference System. The key feature of POISE is that it is completely non-invasive. To capture physiological response commonly associated with abdominal pain, we reviewed previous studies and selected the following 4 sensors. These sensors are closely linked to the physiological changes such as inflammation, vasodilation, muscle tension, and sympathetic nerve system activation. By integrating and analyzing these multimodal biosignals, POISE aims to go beyond subjective reporting and provide an objective foundation for faster and more reliable diagnosis.
In this first aim, our goal is to design and develop a wearable sensing system specifically for abdominal pain monitoring. As we already said, the system will include 4 non-invasive sensors like ECG, skin temperature, blood flow, and muscular activity. We also plan to collect and label this multimodal data under controlled pain conditions. This will allow us to build a rich data set that enables the distinction between different types of pain based on physiological responses. The second aim focuses on developing AI model to detect patterns in the physiological signals. You can see on the right how machine learning can be integrated to process and interpret the collected biosignals. This is the direction we intend to pursue. Despite its potential, our approach also faces several challenges. First, biosignals are often noisy or unstable due to motion artifacts and environmental conditions. To address this, we'll apply adaptive signal filtering and multi-season calibration to improve data quality. Second, there's a high variability in pain responses across individuals, depending on age, gender, stress level, and comorbidities. We resolve this by creating personalized baseline models and incorporating patients' metadata. Finally, many abdominal conditions share similar biosignal patterns like IBS and appendicitis. If our system succeeds, it could significantly improve abdominal pain diagnostics. First, by reducing diagnostic error and speeding up clinical decisions, we can enhance patient safety and satisfaction. Second, the system could reduce unnecessary imaging and invasive procedures, helping to lower healthcare costs and resource burden. Finally, real-time pain mapping would empower clinicians to make faster and more precise decisions, ultimately improving outcomes in emergency and outpatient care. Here are the references we used. Thank you for attention. We are Team 5.